Okay, a brief introduction regarding SPECT-CT. Hybrid single photon emission tomography, computed tomography, or SPECT-CT is an innovative imaging technique able to combine both anatomical and functional information into a single image thanks to the accurate co-registration of sequential near simultaneous acquisition of SPECT and CT. In recent years, it is increasingly being recognized as the modality of choice for the assessment of many diseases. However, when compared to PET-CT, it is still somewhat behind in reaching a primacy over the non-hybrid methodology. To date, the clinical role of SPECT-CT has mainly been defined for whole body examinations in the areas of oncology, nuclear cardiology, and infectious diseases, where there is little evidence on its added value in neurological and psychiatric disorder. In fact, the easier collocation of the brain in a mathematical model will not necessarily require a measured attenuation correction based on CT, as needed for whole body application. Yet, the combined procedure would undoubtedly implement the diagnostic value of cerebral SPECT examinations, such as cerebral perfusion or receptor studies when using a hybrid machine.
Now let's proceed with SPECT-CT procedure.
Patient preparation. First, identify patient identification. Ask for the patient's name and the last four digits of their IC number. Brief patient on the exam. Let them know how long the exam will take. Remind them to not move during the procedure. Remind them to breathe slowly and not to take a deep breath. And if they have any problems throughout the procedure, feel free to raise your hands as we are monitoring them through the CCTV. Next, ask patients for their allergies. Ask patients for their LMP and ensure that they are within the 28-day rule. And last but not least, ask patients to change into hospital gown. During this, ask them to remove any metallic objects on their body.
There will be four things happen during the scanning. First, we have injection. A radioactive tracer will be injected into the patient's body bloodstream through an IV. The tracer travels to the patient's organ and tissue to help highlight specific area for the scan. Second, we have scanning. The patient will be laid down on the table that's moved into the SPECT machine. The machine will be take several images from the different angle to build a complete 3D picture. The CT scan can be performed to provide additional details information about the area of interest. Next, we have duration. So the SPECT-CT scan typically takes around 30 to 1 hour to complete. And the last one we have after scan. So the patients can resume their normal activities immediately after the scan. The radioactive tracer will naturally clear from the patient's body over time. Now let's proceed with the post-procedure. So first we have monitoring. The patient is monitored for any adverse reactions or side effects such as nausea, dizziness, or allergic reaction. Second, we have hydration. It is important for the patients to stay hydrated and drink plenty of water to help flush out the radioactive material used in the procedure. Third, we have follow-up appointment. So the patients will usually have a follow-up appointment with their physician or doctor to discuss the result of the SPECT-CT and determine the next step for treatment if necessary. Fourth, we have restriction. So the patient may be advised to avoid close contact with pregnant women, infants, and young children for a short period of time to minimize their exposure to the radioactive material. The last one, we have medication. So the patients may be given medications to manage any symptom or side effect they experience after the procedure.
There are many interesting cases regarding using of SPECT-CT images. However, for these cases is related to the functions of thyroid. Patient clinical histories for these cases will be a 50-year-old woman presented with a mediastinal mass incidentally discovered on CT scan as being shown on the image below. When the patient had already undergo physical examination, it was observed that the thyroid function tests of the patients were normal. The thyroid was normal on palpation, except there is evidence of ulnus inferior. However, for imaging findings, the thyroid planar image and SPECT-CT image that will be shown later on the next slide demonstrated uptake of iodine within the mass, therefore confirming there is the presence of thyroid tissues. Histological sampling was unsuccessful and the mass was removed by partial thyroidectomy. Can be seen on this image of iodine 123 thyroid scan. The left image shows a normal thyroid between the superior marker and the inferior marker. And for the right images, as you can see clearly on the inferior marker, you could see that there is a subtle and diffuse area of uptake of iodine 123 can be seen below the normal thyroid of the patient. When observing these SPECT-CT images, we could see that there is an orthopic thyroid tissue in the sagittal view, which I refer to the image A. While for the image B, there is an anterior mediastinal mass like I have shown on the previous CT scan images of the patient. While for image C and D, there is an atopic thyroid tissue extends into the superior mediastinum just behind the manubrium. So, what are the discussion or diagnosis that we could make when referring towards the several SPECT-CT images that we already obtained? The tissue masses just inferior to the thyroid gland in the anterior mediastinum may be suspected to be a thyroid tissue. However, the differential diagnosis include a number of neoplasm and the tissue diagnosis is needed, particularly if the mass is causing symptoms such as SOB or dysphagia due to airway or esophageal obstruction. Imaging with iodine 123 or iodine 131 can be helpful for confirming the presence of thyroid tissue. Substernal thyroid tissue often does not function normally, and iodine uptake may be diminished compared to uptake in the normal tissue, thyroid tissue, as in this case. Pathology demonstrated that the mass to be multinodular thyroid tissue or hyperthyroidism.
As you can see in the slide, you can see this the model from the GE Healthcare, which is Discovery NC/CT 670, which is this model have dual gamma camera, which is this camera can allow for image acquisitions for any projection at a multiple angle during scanning the patients. And besides that, this model also increased the precisions for detection efficiency. And nowadays, you can see the SPECT-CT scan was combined with the CT component, but this CT component actually was in the low dose or known as a non-diagnostic CT scanner, and actually was useful for lesion localizations or attenuation map generation for attenuation corrections. So for the physics theory behind the SPECT-CT and CT scans, so you have three, which is the gamma radiations, content scattering, and the photon attenuations. For gamma radiation, we use that as the ability to produce a cross-sectional image of the human body, and in general, we use that nuclear medicine utilize the gamma radiation to form image with a gamma camera by using an internal source of the gamma photon and utilizing that radiation to penetrate body tissue. So, for the content scattering in the nuclear medicine was known as the most predominant mechanism of electromagnetic radiation interact with the metals, and I can say that when the higher energy gamma ray are more likely to interact or weakly bound outer shell electron in Compton interaction, whereas they lose the energy in the elastic scattering and change the directions. And I can say that the most Compton scattering more probably occur in the higher photon entities. The photon attenuation, we have two types, which is the narrow beam conditions and then broad beam conditions. So for the narrow beam condition, actually was applied for a well collimated source for the photon and the detector, and the attenuation was take form on the mono exponential function as you see in the slides. So for the broad beam condition, actually was applied when you're dealing in the vivo imagings that we don't have to well collimated source, but the radar source was emit the photon in all the direction equally. In this table, you can see the narrow beam and the broad beam condition, and the difference between of both actually was important when it comes to apply, attenuation and the scattered correction in SPECT-CT reconstructions, as we have a large impact for the reconstructed data.
Nevertheless, this combination of SPECT and CT modalities do have limitations or challenges, which includes the difficulty in achieving spatial alignment to achieve accurate image fusion, as the two modalities are acquired sequentially with the patient remaining in the same position while the back move between the field of view to be quiet. Next is balancing those with image optimization. Despite the fact that the high number of scatter gamma ray photons associated with SPECT images, we also have to consider in lowering those without affecting the quality of the image. SPECT-CT also required high cost in the equipment and the service planning. Lastly, the long scanning time it takes will also contribute to patient motion, like sudden or gradual change from the start scanning position, which then makes misalignment between these two modalities images, like what we have shown in the picture.
The increasing availability of new hybrid SPECT-CT devices with advanced technology offer the opportunity to shorten acquisition time and to provide accurate attenuation correction. The main advantages of SPECT-CT are represented by better attenuation correction, increased specificity, and accurate depiction of the localization of disease and of involvement of adjacent tissues. Endocrine and neuroendocrine tumors are accurately localized and characterized by SPECT-CT, which is superior to SPECT alone, and this leads to a decrease in the number of equivocal findings. This also applies for solitary pulmonary nodules and lung cancers, brain tumors, lymphoma, prostate cancer, malignant and benign bone lesions, and also infection. Hybrid SPECT-CT imaging is especially suited to support the increasing application of minimally invasive surgery, as well as to precisely define the diagnostic and prognostic profile of cardiovascular patients. These applications of SPECT-CT to other clinical disorders or malignant tumors is currently under extensive investigation with encouraging results in terms of diagnostic accuracy. That's all from us. Thank you.